Hello, my name is Chris Parham, and this is my final project called Vestibular/Vertigo. How to use symptoms of vertigo to create experiences of disgust. Vestibular dysfunction is a disorder that affects your balance, that makes you feel dizzy, nauseous, or off balance. Vertigo is a condition that causes dizziness and is often caused by an inner ear problem and makes someone feel that they are either spinning or moving when that person is actually standing still. I would like to show how symptoms of vertigo can lead to experiences of disgust. Common causes of vertigo are caused by an inner ear problem. BPPV stands for benign paroxysmal positional vertigo, and the inner ear sends signals to the brain about head and body movements, and it helps you keep your balance. Meniere's disease is an inner ear disorder caused by a fluid buildup and changing pressure in the ear, and causes episodes of vertigo along with ringing in the ears and can create temporary hearing loss. Other forms and types of vertigo. Peripheral vertigo is triggered by physiological alterations in the inner ear that control balance, and central vertigo is triggered by neurological disorders in the brain. Psychogenic vestibular vertigo is caused by psychological factors such as anxiety or depression, obsessive compulsive disorder, panic attacks, hyperventilation, lightheadedness, acrophobia, and dizziness. The main differences between vestibular neuritis and labyrinthitis is that vestibular neuritis refers to inflammation of your ear only, while labyrinthitis refers to both the vestibular nerve and your cochlear nerve. And again, these are the three most kinds of vertigo, as you can see here, as what we discussed earlier. And BPPV happens when calcium carbonate crystals known as otoconia are embedded in the inner ear, but if they become dislodged and move into the semicircular canals of the ear, they cause the fluid to move and it leads to dizziness and vertigo. Vestibular neuritis is an infection of the vestibular nerve, with the nerve sitting in the inner ear, and detects balance by sending signals from the inner ear to the brain, which can bring on a symptom of nausea. Meniere's disease can cause rapid eye movements, with the patient's eye basically operating on its own, with constant uncontrollable movements as a result of this form of vertigo, and it is called nystagmus, and it may affect your vision and balance. Acetaldehyde is a toxin produced with candida, which is the most common form of fungal infection. But when the liver becomes oversaturated, it gets released into the bloodstream, creating feelings of brain fog, intoxication, vertigo, loss of equilibrium, and loss of balance. Motion sickness is related to vertigo, and it's due to the difference between actual and expected motion, and your inner ears control your sense of balance, and parts of the vestibular system include the utricle, which detects horizontal motion, and the cyclo detects vertical motion. Diarrhea is also a symptom of vertigo, and it can make people who have vertigo very dehydrated and thirsty and prone to more vertigo attacks. But vertigo does not cause diarrhea, as the vestibular system affects the digestive system. And what we have here, we have our references, and I'm also going to be putting in my film as well, which is basically going to be showing my experiences for disgust and the words that I use. And you'll see that in the next film when I add it on. Thank you.